going to take out just so you know.
Yeah, that's right.
And
Corey will be editing it, so I'm going to do that. All right, so Kiara works for the Council on Alcohol and Substance Abuse, BB CASA, the group that stole our name, but we've discussed that. Anyway, so she works on both the prevention side and the treatment side. So she's going to talk to us about alcoholism and addiction and also the services that BB CASA provides. Most of our families get referred, well, the ones who have substance abuse disorders get referred to BB CASA. So we're glad you're here. Thanks for being with us tonight.
Thank you. Okay, so I'm Kiara, and I work at BB CASA. I work in the PPI program and also with adults in the outpatient program. And PPI is Pregnant and Postpartum Intervention. So that is our Baby Love program. I don't know, has anybody heard of it? No? Okay. So the Baby Love program, it's just for women, and it's for pregnant and postpartum women. We see the teens at the high school too, like all the schools around here, and then we also go to outer counties like Madison County, Leon County. We talk to the pregnant or postpartum teens, and also I would say probably about 85% of our referrals come from CPS. So there's a big number of referrals to BB CASA. So the Baby Love program, it's a 10-week program. It's a parenting program. We have it 2 nights a week. It's Tuesdays from 9 to 10 in the morning, and then Thursdays from 5:30 to 6:30 in the evening. So there's a little bit of option if we refer them to the Baby Love program and when they can come. So like I said, it's a 10-week program. It's a parenting program. So it's way less intensive than outpatient treatment. So they're either there for 1 or 2 hours a week, depending on the severity. Sometimes we'll tell them to go to 2 classes per week if they're more severe, or if we don't feel like they need treatment, but they need some sort of type of intervention. The Baby Love is actually intervention, it's not treatment. So we just go over different parenting topics with them every week. We do touch on addiction, domestic violence, like keeping your children safe and healthy, fetal development, child development, just all kinds of parenting topics. And then so I teach the Tuesday morning group for that, and then I also work in the adult outpatient treatment. So we have an intensive outpatient treatment program, and it's 4 nights a week. It's Monday through Wednesday, 6 to 9, and Thursdays it's 5 to 8. So it's 12 hours a week. And there is also 1 hour of parenting that's required. If we have CPS referrals, they have a 1 hour parenting class that goes in with the outpatient treatment as well.
Is this program for any of the parents that we see who are pregnant, or is it for teenagers?
Yes, so with the Baby Love program, if they have an open CPS case, they can have a child up to 6 years old and still do the Baby Love program.
Oh, okay.
And so if there's no CPS, they can have a child up to the age of 18 months and still do the program. So, and most of the women do normally have an open CPS case. Do y'all have any questions so far? Anything that you did?
what's the difference between intervention and treatment?
So intervention, you're just trying to intervene before it gets, to the point where they need treatment. So it's just it's not as intensive. So you're just trying to, you see maybe there's a problem, like maybe they're, smoking marijuana once or twice a month. We generally are not going to put them in intensive outpatient treatment for that. But we do, like in that case, we would refer them to the Baby Love program. And so we do drug tests, random tests in the Baby Love program, and if they do test positive, we will refer them to a higher level of care.
So when CPS assigns parenting classes to parents, they'll do them with you?
Yes.
Okay, what are your assessments? First of all, you have, I'm assuming, requirements for attendance. So
Yes.
you note when they're not, or if they leave earlier, all of that.
Oh, yeah.
What do you do in terms of assessing their integration of the information you present?
Well, so we do have a pre-test and a post-test. So when they start, they take a test. It's 20 questions, I believe. And then when they're done, they take the test again, so to see if we're, doing our job and teaching them things. So that's the main way that we assess
If they,
their.
oh, I'm pardon.
Go ahead.
Well, I was just gonna say, okay, so, if on the post-testing, it reveals that they really have missed some key concepts, do you let the CPS person know, or CASA can go ahead and inquire about that? And then,
And normally, so throughout the program, we kind of, we definitely keep in touch with CPS and let them know if they're not showing up, or, normally we don't have any problems, like within the group, they don't ever really, it's never a problem, just really with attendance, that's the problem. If they're not showing up, we definitely, get the consents for CPS, and we let their caseworker know that they're not showing up. And then usually CPS will call and they'll show back up the next week. So one thing that we do sometimes have trouble with is that when CPS closes their case, they don't have any reason to keep coming, or nobody to force them to come. So that's one thing that we have had a lot of trouble with, because CPS will close if they're testing clean for CPS, they can't leave their case open. And it is something that we've talked to the caseworkers about, but that is a big reason for our dropout rates, is because the CPS case gets closed and then they don't have anyone, telling them to go. And once their case is closed, sometimes some certain caseworkers will tell them, you need to finish the program or you'll get another case reopened. So sometimes that, that makes them come. But that is a problem that we have.
And I'm gonna guess that most of the cases that are at BB Casa are gonna be family-based safety services. Most of the parents that we're working with, their kids have been removed, their drug problems are gonna be a little more intense.
Okay, yeah.
Yeah, that would be my guess. But I know we do have moms and dads that go for their initial assessment at BB Casa and do go through the Baby Love program.
Yes, and also, so if their problem is more intensive, then they probably will refer to treatment anyway. And normally the CPS, they won't close their case till they have completed the outpatient treatment successfully. If it's more of an intense problem, or like a harder drug like meth or cocaine, things like that. I see the marijuana cases getting closed pretty easily, but generally, if someone comes with a harder drug problem, we normally don't do Baby Love for them. It's more the outpatient treatment or inpatient, depending. We don't have inpatient treatment, but we can definitely facilitate that and help them get on a waiting list for an inpatient bed and things like that.
In other words, they will go to a facility or something.
Yes, because there's no, BB Casa does have residential, but it is for people coming out of TDC or SafeP, and it's like a halfway house, kind of, it's aftercare. So there's no residential treatment here in Bryan College Station. They normally have to go to Houston, Austin, Waco, places like that. Mm-hmm.
So for those cases where substance use is the issue, I know you mentioned that they have to do 1 hour parenting class as part of their treatment program.
Mm-hmm.
Is that the parenting class for that? No, they
No,
have to
this
do
is
that
different.
additional.
Yeah.
Okay.
Yeah, because there aren't very many certified, you have to be certified through CPS to provide a parenting for CPS. There are very few here. Many times the therapist is charged with doing the parenting
Okay.
education.
Okay.
And then what we look for is, are things improving during those supervised visits? Is mom on her phone the whole time? Is she being appropriate? Is she playing with, you kind of saw that in the removed thing we saw, where the baby was more comfortable with his sister than he was with the mom, that kind of, so we would observe visits for that kind of thing.
What other questions do y'all have? Sorry, I know I kind of skipped around.
What would you say are the primary substance issues here?
Like what people mostly come in for? Meth. Meth, definitely a lot of meth. Marijuana, marijuana and meth. I know y'all have probably heard about the opioid epidemic that's going on. We actually don't have a lot of people using opiates here right now, but it definitely is a problem in other places. But yeah, mainly I see a lot of meth and marijuana.
Say, for instance, y'all get a person in that with an opioid crisis, they would have to go to a facility.
Well, it depends on how.
Parents like that.
Yeah, it depends on how much they're using and how frequent. So like there's gonna be people that aren't appropriate for our outpatient program. Like if they're using heroin, 30 out of the last 30 days, and they're not gonna be appropriate for our program. So we would send them to a detox facility so they could detox safely and comfortably off the opiates. And then they would do like a 30-day residential program. And a lot of times people will come after residential and do outpatient for continued support too.
What about prescribed medication? How many of those people, like, say, hydrocodone?
Oh, we haven't seen a lot of those. I haven't seen a lot of people using opiates lately, which I'm kind of surprised because it's a big deal in other places, but.
Because one thing, they talk about the crisis, but you gotta look at your doctor.
Yeah.
I had surgery, and they gave me a bottle of 90 hydrocodone.
That's how it starts. That's how you hear a lot of people saying their addiction starts
And
is
I
getting
took-
pain medications and then,
I took one and they made me sick, they made me hallucinate.
yeah.
I lost about 12 pounds in total weight.
Oh, wow.
So you were not addicted to them?
I quit taking, I told them, no, ever give me anymore. And I've had folks made the surgery in 2 years, and I just don't take this thing.
Oh, wow. Yeah, that's, a lot of people say their addiction to opiates starts that way with some, like a major injury or like a surgery, and they get pain pills and the doctor will like abruptly just cut them off. And then you have withdrawals. I mean, you don't feel well if you've been taking opiate medications for a while and then just stop suddenly.
I can wake up through the night and relive a conversation.
So, and then pain pills are pretty expensive to buy, just, that aren't prescribed to you, so then that leads to heroin use. And so, and then, the fentanyl and the heroin, have y'all heard about that? So, fentanyl is an elephant tranquilizer. It's 100 times more powerful than morphine, and people are cutting heroin with that. And that's why a lot of people are overdosing on heroin, because they don't know if it's cut with fentanyl. There's even carfentanil, which is even stronger than that. So those are synthetic opioids that people are cutting with heroin. And so that unfortunately is why a lot of people are overdosing, especially, and it's like I said, it's not so bad here right now, but in other states definitely. And it could easily become a problem here pretty quickly, I'm sure. Do y'all have any other questions?
What would you say is your estimated success rate? How often do you see people returning?
I don't have a number, but since I've been working at BB Casa, I've been there for the past year and a half, I've probably seen, 10 or 12 people go through the program and come back. So I don't know the exact success rate. I'm sorry, I couldn't find that out.
I'm just curious if, you had a feel
Yeah.
for what that might look
I
like.
do see people come back, and then when they come, like looking in their records, you can see that they were there before. So there are definitely people that come through, 3-4 times.
Can you talk about the disease of addiction
Yes.
and kind of that process?
Yes, I was gonna go right into that too. So, so does everyone here agree that addiction is a disease?
Yeah.
Okay. So a lot of trouble I see is that people don't believe it's an actual disease, that they believe it's a choice. So the first time that you do use it is a choice, right? But you say you go have a drink. 2 out of 10 people are gonna have a problem. 8 out of 10 people are not. So addiction is actually a lot less frequent, I guess, than you think, because I guess you hear about it a lot and you see it a lot, but actually, like I said, 2 out of 10 people have an addiction, whereas 8 out of 10 people can go have that drink or whatever and not develop a problem. But so addiction definitely is a disease. And like I said, a lot of times people don't believe that. They tell me it's a choice. So you make the choice to use in the beginning, but so after that, the addiction or the drugs change your brain. So when you use drugs, it floods your brain with dopamine, way more than it's ever seen before. So and dopamine is your reward circuit of your brain. So dopamine is what makes you feel happy and good about things. So when you do small things throughout the day, like eat your favorite meal or just the small things like that, your brain lets out a little bit of dopamine, and you feel good, you feel happy. But whenever, say, you use meth, your brain is flooded with more dopamine than it's ever seen before, and that is positively reinforcing your brain to keep doing that. That's why it's so hard for people to stop, because your brain is telling you to keep doing it, this makes you feel good, this makes you feel great. So, and then that's also why, you hear about people, coming down off drugs. They don't feel good, they feel depressed. It's because you've depleted your brain of its dopamine. I know my supervisor, she always says that you can use, and this might be an exaggeration a little bit, but that you can use a whole year's worth of dopamine on a week-long meth binge. So, yeah, I mean, that's probably not that much of an exaggeration. So definitely, your brain gets flooded with dopamine, and that's what positively reinforces it. So that's what tells you to keep doing it. Sorry, I have to look at this so I don't go blank. So addiction is a primary condition. So do y'all know what?
No.
Okay. So a primary condition means that it's not just a symptom of something else. So a lot of people that have mental health diagnoses, they use drugs and alcohol to self-medicate. So if you have a mental health diagnosis and substance use disorder, those are both primary. So generally when someone has mental health and addiction, it's really good for them to get treated together. So so primary means that addiction is not simply the symptom of another problem, like a psychological disorder. So that's primary. And then addiction is also chronic. So it doesn't get better over time, it gets worse. So a lot of we always like to compare it to like diabetes. So people get treated for diabetes, right? They take their insulin or whatever the case may be, but also it's in addiction it should be the same way, but people don't feel that way. There's a lot of stigma around addiction, right? So people don't like to get treated for addiction because they feel ashamed, embarrassed. They feel like, why can't I stop on my own? Things like that. So it doesn't, like if you had untreated diabetes, it wouldn't just get better. It would get worse, right? So it's the same with addiction. So generally it doesn't just get better one day without treatment. It generally gets worse over time. Let's see. And then so addiction is actually in the DSM-5. So it is considered a mental health disorder. And so the criteria for diagnosing addiction, I'm just going to read these to you. So according to the DSM-5, substance use disorder is a problematic pattern of substance use leading to clinically significant impairment or distress as manifested by at least 2 or more of the following occurring within a 12-month period. So 1, substances are taken in larger amounts or over a longer period than was intended. So like they say, oh, I'm only going to use this much and end up, using more, or I'm only going to use this day and they end up using all weekend. And then there's a persistent desire or unsuccessful efforts to cut down or control alcohol or drug use. And then a great deal of time is spent in activities necessary to obtain substances, use them, or recover from their effects. And then cravings or a strong desire or urge to use substances. Recurrent substance use resulting in a failure to fulfill major role obligations at work, school, or home. And continued substance use despite having persistent or recurrent social or interpersonal problems. So that's one where I see a lot where, so women continue, or even men even, continue to use despite CPS being involved, their kids being taken away. You know, and that's another place where they're really judged and they feel really embarrassed about, you know, about the fact that their kid is taken away, but then they still continue to use drugs. And I feel like that's one thing that's a problem too, is like the stigma of them coming to get treatment and then being honest about their use, is because they don't understand why they can't stop using whenever they're in danger of losing their children, or like in danger of health risks. So like people, I see people that, you know, they tell me they have hypertension and they are using cocaine. You know what I mean? So just all kinds of negative things are happening to them, but they continue to use anyway. And then important social, occupational, or recreational activities are given up or reduced because of substance use. Recurrent substance use in situations in which it is physically hazardous. And substance use is continued despite knowledge of having a persistent or recurrent physical or psychological problem that is likely to have been caused or exacerbated by substance use. And then tolerance, which is the need for more drugs to feel the same, or to feel the desired effect. And withdrawal is manifested by either of the following withdrawal symptoms, or substances are used to relieve or avoid withdrawal symptoms. And so substance use can be mild, moderate, or severe. So the presence of 2 to 3 symptoms in the past 12 months is mild, moderate is 4 to 5 symptoms, and severe would be 6 or more symptoms. So that's what we use. So when people come in, we do screenings, and those are the questions that we ask them all have to do with the DSM-5 criteria for substance use disorder. And then to diagnose them, that's what we ask them a series of questions, all having to do with this, and then we make our diagnosis by how many yeses they say. Do y'all have any questions about that?
When you work, I don't know if you work with the youth or not.
I do. I forgot to say that I'm actually one of the only counselors that does work. We don't have a lot of youth. Recently, I know the juvenile probation, I think, started their own treatment program.
Did they?
And so we don't have as many youth as we did. I've had probably 3 youth clients in the past year and a half, so not a lot. But we do the CYT curriculum with them. It's cannabis youth treatment. So their treatment is a little bit different than the adults, obviously. But they, generally the youth are just using marijuana, so.
Could you talk about like the use, misuse, abuse, and addiction? Do you use that kind of?
Yeah, so the stages of addiction. So the stages of addiction, so it starts off just using maybe to have fun at a party. Like maybe you're at a party and your friend has some weed and you smoke it. That's just use. And so you don't, you're not going out the next day like trying, seek it out or things like that. It's just to have fun. There's no like regular pattern of use. And that turns into, or it could turn into occasional use, which is about 6 to 10 times per year. And that's still like really by chance. You're not like seeking it out, like maybe your friend has it and you join in on them or with them. And then that can turn into abuse. So where you're now at that point you're using, there's a regular pattern of work of using. So maybe like having a beer after work every day, or maybe smoking 1 joint a day, whatever the case may be. So there's a pattern now. Or maybe you only use on the weekends. Whatever your pattern is, now there's a pattern. And that turns into, so that's regular use, and then that can turn into abuse. And that's when there's kind of no control over stopping, and you put it before, you make it your top priority. So you'll pay, you'll go buy drugs before you pay the rent, or you'll, do whatever you can to get the drugs, and that's the most important thing.
Yeah, and I would say in a lot of these affidavits that we've been getting in, I know we've been talking a lot about the removals that we've been seeing lately. High number of them are infants. I even had one that was just called Baby Boy, whatever the last name was. He wasn't even named yet when he got removed. And almost all of them, the mother admits to using marijuana or smoking meth while pregnant.
Oh yeah, we get that a lot.
I mean,
definitely.
and that to me means that's my first priority, and that is what we're seeing more and more of right now. It just seems to be there's usually some sort of pattern, and this seems to be the pattern right now.
Yeah, definitely, like she said, meth and marijuana, I have had quite a few clients come in saying that themselves and their baby tested positive for meth when they had the baby. I mean, I see that probably 2 or 3 times a week. A lot of meth use during pregnancy, a lot of marijuana use. A lot of times they'll come in and tell them the doctor said it was okay to use marijuana, and it's better than cigarettes, and I hear that. I hear stuff like that all the time. And miss, it's legal in Colorado. I hear that. Yeah.
Well, and the thing that always some of our that we talk about is everybody will say, well, marijuana is not addictive. Well, that's because it doesn't have the same kind of withdrawal that you see from alcohol or heroin. It's not fast. It takes about 30 days to get out of your system. If you withdrew as fast from marijuana as you did from alcohol and heroin, everybody would know it was addictive.
Yeah, you would feel. Yeah,
would
because
feel it, yeah.
you alcohol is coming out of your body, within 6 to 8 hours, and heroin, 2 to 3 days, it's starting to come out. Or come out completely. With heroin, you start to feel withdrawals after 6 to 8 hours, I guess, maybe 10 hours. But so that's the thing, is that marijuana comes out of your body so slow, you don't tell the withdrawal symptoms. You can't.
And it's depending on your body weight and your body. I used to do that for the lady, and go with people when they get drug tested, they had drug issues and stuff, and they trace marijuana depending on your body weight and fat.
Yeah.
6 weeks, 30 days to 6 weeks.
Yeah, so it takes a long time, so it's just such a slow process that nobody really even notices. But yeah, definitely, like she said, if it were to be as fast as alcohol or heroin, you would be able to tell.
And somebody else, Becky, you had a question? I think somebody else did too. Go ahead, Becky.
I kind of have 2 questions, so sorry. So I know a lot of times there's court mandated rehabilitation or treatment, but are there also court mandated meetings that they have to follow up on? So once they complete like a 30-day treatment, do they have to continue with a program?
So we definitely recommend it. So whenever our clients they've completed the program successfully, we create a discharge plan with them together. And so a lot of times we like to have them hooked up with AA or Celebrate Recovery. And Celebrate Recovery is more of a faith-based recovery for people that are Christian. AA is not everybody's thing, and that's fine. But we definitely like to have them, either finding an AA meeting that they like, or that's on their discharge plan, is to attend or support meetings. It doesn't have to be AA or NA. A lot of people really love AA. They work the steps, and it's really helpful to them. I hear people say that it's just not their thing. So definitely we can't, after they're done with our program, we can't force them to do any support meetings, but it is definitely, we definitely push that and recommend that they, have some sort of continued support.
And they can court mandated when you're on probation.
Okay.
Or parole, for that matter. So
Yeah,
sometimes you
probation
see
and parole.
courts mandate it, but if you've got a card that said, I attended this meeting on this day, well, it's an anonymous program. You could get your neighbor to sign it. Nobody's gonna know the difference. It's not really the world's best system.
Right.
But I've also known people who were on parole or on probation, and that's how they got introduced to recovery. So, just depends.
Yeah, because whenever they go, so whenever you get put on probation or parole, they ask you a bunch of, they like assess you. And a lot of times they will send them, the probation officers or parole officers will send their clients to us if they have said they had a drug problem in the past, or, they, drink alcohol while on probation, things like that. So they're not allowed to drink alcohol while on probation, not
Can't go
even
to a
allowed to be
bar.
around alcohol.
Can't have it in your house. Being on probation stinks. I don't know that for a fact. A probation officer usually comes and does one of these trainings, so we find out a lot about probation.
Yeah, they're not allowed to be in places where they sell alcohol, no bars, no,
Like no restaurant.
You go to Target.
yeah, you're not supposed to go to restaurants where they have bars,
Yeah.
none of that.
None of that kind of stuff. Being on probation is hard. It's
And-
punishment.
And with people that have DWIs, they generally will send them to us for a screening. Sometimes if it's the first DWI, they don't necessarily just get sent to treatment. We do have a few other classes we have choices, not chances. That's for somebody that, they need some, it's an 8-hour education course, so somebody that maybe needs some education, but they don't really qualify for treatment. And we also have sobering facts, that's for the youth. So that talks about, drinking and driving and using drugs while driving, and then like marijuana use and just things like that. So that's really good for the youth, that they don't really need treatment, but